Okay, so coming up here, we know that physical examination, that's the procedure you have to actually take out after history taking. You know that you know that physical examination is actually divided into two types. That's a general examination and the specific examination. So general examination, you're like looking at the whole patient. You come to the bed, you look at them. Specific examination, that's when you have already suspected that, okay, this problem is here. So you go straight to this place and actually examine the place. All right. So we're looking at the general examination procedure. All right. How do you perform general examination? The focus is for us to discuss general examination procedure. And this is basically a doctor trying to look at clinical examination of the lungs, right? So clinical examination of the lungs is the picture we have here. So in order for you to perform a general examination of a patient in the hospital, yeah, you have to like stand at the foot of the hospital bed and observe the patient. Okay, so look at them. Are they looking pale? Are they looking weak? Are they looking anxious? Are they sweating profusely and all this stuff? All right. So you look at them and you actually get to know that is he or she acutely or chronically ill looking. Are there signs of weight loss? Do the patient have prominent zygomatic arches and ribs? All right, like you get so thin that your zygomatic arch are like prominent, showing up. Okay, so do they have cachexia? That's general wasting. Okay, your muscles are drying up. All right, you're generally wasting away. So are the patient looking anxious, too active, or are they looking depressed? Okay, so these are all the things that you note in general examination of patients. Okay, so in general examination, you look out for things like, are the patient pale? Are they looking pale? So this is an image. General examination. I know that they are holding a thermometer, trying to measure out some things in the mouth. So you look for pallor. Are the patients are their skin looking white? Jaundice. Do they have yellow coloration of the eyes? Cyanosis. Are their skin be like bluish or stuff? Lymph nodes. Are the lymph nodes swollen up? Alright, so now the knowledge of the lymph nodes that you learn in anatomy is so important in this place because let me say I have a swelling on my buttocks, my mid-inguinal lymph nodes will be swollen up. If I have a swelling inside my neck, my cervical lymph nodes will be swollen up, and so on and so forth, right? So you know where the lymph node is located and the region where the lymph node is draining. Okay, so how about hands and feet to check if the hands and feet are cold? All right, clubbing if the hands are like clubbing. Then palmar erythema, area is there like water in the hands and legs, like leukonychia, splinter hemorrhages. The oedema is basically like swelling. All right, so you check for swelling in the body. Do you have swelling in the ankles to the thighs and sacral oedema and all that? Okay, so this is it, and this is a general examination. Okay, so general examination. Okay, so let's just talk briefly on the procedure of general examination or physical examination. We have auscultation, you listen to the body. Inspection, you look at the body. Palpation, you feel the body. Percussion, you tap the body. Okay, so AIPP, auscultation, you listen. Inspect, you look at. Palpation, you feel. Percussion, you tap. Okay, so now you have to know the normal for you to know the abnormal. Okay, so if I'm palpating your chest, I know that the chest should normally sound like this. If the chest is sounding empty, then definitely I know that something is wrong. Okay, so guys, that's it, and that's the procedure in general examination of patients. Okay, so guys, that's it, and see you guys next time.